Everyone, and welcome to our webinar, Optimizing Patients' Internal Health Through Medical Wellness. I am the marketing manager here. My name is Hannah, marketing manager for Rare Group. We are a market research and technology consultancy that specializes within medical aesthetics and the wider healthcare industry as well. I am joined today by Ben Pask, who is founder of Rare Group, and Claire Reach as well, who is director of Aesthetics Collective, a consultancy that supports manufacturers around the world understand the medical aesthetics market. There will be a Q&A session at the end of the presentation, so please do send through any questions you may have using the Q&A button at the bottom of your toolbar. I will now hand you over to Ben and Claire, who will take you through the webinar.
Great. Thanks, Hannah. Hi, everybody. So in terms of what we're going to cover off today, these are the things we'll be speaking about. So prior to the webinar, we did a little bit of research, which we'll be talking you through in today's session. And Claire and I will be discussing some of the findings and what that might mean for people who work in the sector. We're going to have a deep dive in terms of people's attitudes towards their own internal health and what they perceive to be their barriers in order to achieve what they want to achieve with their health outcomes. We're going to discuss how people are taking control over their own health, the different tools they might use, different things they might well be doing. And then we're going to be talking a lot about, what's the opportunity within the aesthetics industry. And that's why we're really excited to have Claire here with all of her expertise and insights with how different operators work within the sector. So if you have any questions, do put them through to Hannah. We'll fill them out at the end and discuss them. And it's a really good opportunity to get Claire's view on things. So in terms of the data we captured before today's session, so we really wanted to understand, how do people feel about their own internal health? What are their desired outcomes and so on? We know within aesthetics, which is a sector that we work in quite a lot, that predominantly generally tend to find that the cohort is female of a certain income bracket, although it is obviously quite a broad audience. So we focused on that particular cohort for the purpose of today's session. We ran the research at the end of June, so last month, and we know that the data is within the bounds of what we would consider to be a robust sample to work with. So there's some really interesting insights that come out, and I think one of the real sort of encouraging parts here is that when you interview women of a certain income, is that many of them feel that actually there's more they could do to improve their overall health, and there is certainly a motivation and a desire to do so. And I was wondering, given your experience, Claire, and all the things that we've, I suppose, have been through over the last few years, do you feel that post-pandemic there's a change in people's focus with a desire to improve their overall health, or do you think this is something that remains pretty steady as it was before?
Hi, Ben. Yeah, it's an interesting question because COVID has definitely sped a lot of things up. We know there was already a trend, though, with people thinking more about, okay, how do I maximize my health, optimize my health for the long term? But considering that we were all barraged daily with constant information about how we should be washing our hands and making sure that we stay healthy and don't get hit by COVID, that's really come to the forefront of people's minds. So as I said, it's sped up a lot. It was there originally, and I think it was 2019 when I was talking with medical aesthetic healthcare practitioners about how they were starting to integrate a holistic approach. And now we've just seen that happen more and more with other clinics because patients are demanding it. So it's good to see that people are starting to think, actually, there is things that I can do for my health, and they're starting to talk about it with the right people.
Yeah, great. So we've seen with the data itself, we were kind of interested to know, well, if we want to understand how people feel about their health and their desires to change, if at all, we wanted to understand what the biggest sort of perceived barriers might be. And what we found within the data set was that for this particular cohort, we found that around half of them claimed that being overweight and obesity they felt was the biggest threat to their health, and that 53% of people had generally a negative attitude towards their health. And it's interesting when you compare across age groups, because it's you know, overall we do see health as being the most sort of the biggest perceived threat amongst all age groups. But when you split it down by particular cohorts, you can see, for example, mental illness is something that's seen as being a bigger perceived threat amongst younger age groups, whereas as people get older, that generally from this data we see that people feel that being overweight is actually perceived to be a larger threat. So I was wondering, Claire, given your experiences, you know, how do you, when the data you see and the work you've done with different practices, is this something that stacks up with what you've seen before and what might be?
Yeah, so I know through my work with Novo Nordisk, which I've been over the past few years, is that almost 67% of the UK population is either overweight or obese. So absolutely, that it being second here, that's the most worrying issue for women of this age group is completely in line with what we see. I think from this bar chart, we can see that mental health and exercise, or lack of exercise, also feature highly. And in fact, they're probably all quite related, aren't they? If you think about your weight can affect your mental health, how you feel about yourself in terms of your confidence, they all play such a big role. Then exercise or lack of exercise, although we know obesity and overweight isn't just about calories in and calories out and eating less and moving more, exercise really plays a big role in making sure that you can stay at a healthy weight, and also that you can maximize your mental health. I think it's Joe Wicks, the body coach, has been really strong through COVID with that, and recently. So all of those top three things that are shown there are actually very related. So it's very much about weight as a catalyst to think about your overall health, whether that be mental health or lifestyle changes or other parts on their nutrition, for example. So yeah, it doesn't surprise me, and that fits very much in with what the experiences that we see.
Yeah, I was wondering as well whether, because the sort of variety of responses that you get with this to sort of indicate there's a different level of understanding. Do you perceive education as being, you know, a bit of an area that needs focus when it comes to issues like weight loss, for example?
Yeah, absolutely. And again, that's been helped a lot by COVID, because we have thought a lot more about how things work in our body. But even in the 3 years that I've been consulting with Novo, it's been a huge change that we've seen, that eat less and move more is not the predominant feature now, or I would argue that, because I talk about it regularly. Maybe it still is out there, and I think especially for the older group, I think you show later that the over 55s really think that is the best way to maintain your weight. Now, we know up to a certain level that's correct, but once you push past the overweight or obesity category, it is really hard to actually lose weight, because there's so many different things going on in your body in terms of the hormone changes. You actually have a thing called a set point, where your body tries to fight to actually keep the weight that it's had for at least the last 2 years. So things like just doing diet and exercising, cutting out carbs or something like that, will not make a fundamental difference for these people. If it did, we wouldn't have the diet industry, because people would lose weight once and it would be fine and you'd never have to do it again. But the fact that we do, and the fact that people struggle continuously to decrease their weight to a healthy range, shows that it's not just about eating less and moving more. And there's so many books about that now, and professionals, healthcare professionals, really speaking about that.
Yeah, great. One of the topics we wanted to understand was how people taking control of, you know, their internal health. And I think it's quite an encouraging stat we see here, is that generally speaking, women with a certain household income of 50,000 or more are very interested in taking control. So you've got almost 9 in 10 saying they're very or somewhat interested in managing their own health. And I think what's also quite encouraging is you're seeing 58% say that they feel they can influence their current health as well. And it's I'm sure everyone's seen it. You know, if you go, you know, you read the Guardian or the Times, what have you, that seems to be every Sunday you see some sort of research report that comes out talking about this sort of change in habits that are quite generational. So a few years ago, there's quite a lot around younger people not necessarily drinking as much alcohol, as maybe, you know, previous generations. So I'm sure that being a student in the early 2000s is quite different to being a student now, particularly with the price of beer. And that we're seeing evidence of people changing their diets, experimenting with alternative ways of eating, and also the role of technology. And I think more also what we're generally observing is there's quite a lot of movement around people aspiring to a certain lifestyle that is healthy. And are we seeing, particularly with the work that you're doing here, Claire, whether again this is something you're seeing within data that you get and you observe looking at the, you know, across, you know, kind of traditional research reports compared to what we might see in the media? Are we seeing that this actually does stack up with what you guys are seeing there?
Yeah, well, we know the media has such an influence on people's thoughts in society anyway. You mentioned the Times and the Guardian, but the most read newspaper in this country is the Daily Mail. And you only have to look at the change in features and the change of language they have in terms of health. And they're the ones that are also featuring weekly updates on lifestyle changes that you can make for a better night's sleep. And they're also talking really regularly about medications that you could take to improve your health. There's a huge media push for actually thinking about health and lifestyle, and they follow the trends as well. And that's because with their younger groups coming up, they're reading a bit more, they want to learn about these aspects. As you're talking about going to university in the noughties, we were probably a bit more naughty than the younger kids now, judging by what I hear from younger friends or kids of friends. For example, my hairdresser, who's 24, when I was talking to her about what I do, she said, oh yeah, I'm constantly thinking about how I can make sure that I stay healthy long term. So I said to her, that's a lot of what I talk about. It's like, what kind of 70-year-old do you want to be? Do you want to be the 70-year-old that is playing with their kids in their grandkids in the garden, playing football? Or do you want to be the type of 70-year-old sitting in a wheelchair popping pills? And that younger generation is thinking about it a lot earlier than we ever have. I think I speak to a lot of my friends my age, they're thinking about it now, but it takes till the 40s to start thinking about it. And that's where we're seeing the market come through with medical aesthetics, and a lot of clinics have the crossover between that group of people, especially women, who are thinking, yeah, I'll get a bit of Botox or fillers or laser treatment or something like that to make myself feel more confident and make me feel my best self. But then is there anything else I can do to make sure that I'm maximizing my health now and in the future? So we're the ones this age kind of driving that, but it's only going to become bigger, as what you can see by the media. And what I talk to younger people is they are thinking about it so much earlier than we ever did, which is really exciting for where this market is going. But also quite shocking that, yeah, they're going to live a lot longer than we ever will.
That's a hot take, but it's probably true.
Yeah, probably.
Yeah.
They're a lot healthier, a lot younger than we are.
Yeah, well, it's certainly a lot more of a focus of it. I mean, I remember my university experience, it wasn't really something you really thought about, to be honest, sort of post-uni. But I was wondering, you mentioned there about, you know, we see in research, when you look at the different sort of segments of people who are interested in aesthetics, and you generally find that you've got your kind of roughly a third of the market, and maybe more like 25% are, you know, under the age of 35, broadly speaking, and they're either sort of driven by social media or the fact, this kind of feeling of I'm getting older, or I can feel myself entering, you know, the sort of the next stage of life, be it, you know, marriage, children, etc. You get the set that for them, you know, it's normal. That's the group we sort of refer to in the middle, and then you get the other roughly a third who are driven by age. But you tend to find that the younger generations, rather than it being driven by age or by the fact that they exist in a social context where it's normal to have treatment, the younger generations are driven more by confidence about how they look and how they feel. And given the role of an aesthetics practice, do you sort of see that as being an opportunity to answer the needs of all these five groups? Is there a kind of a long-term opportunity there potentially?
Yeah, well, absolutely. If you think about what you need to develop a market, we have the treatment itself and something that is seen as useful, valuable, and actually delivers what it says it does. We have the patients group and we have the HCP group. So the patients are showing an interest and they have the demand for that. So we've talked about what kind of 70-year-old they want to be, but we also talk about, okay, they're thinking about their skin treatment, but how do they improve their skin from the inside out? How do they improve their body health and look from the inside out? You can't have the outside just trying to do everything, some machine trying to do everything while you're putting McDonald's in your mouth constantly. It just doesn't work that way. So they're thinking about both with the patients. With the HCPs, we know a lot of them have come from a general practitioner background or another NHS-based background. So they have the skills in terms of thinking about that level of general health. And I don't think it's a very big jump for them to start thinking a little bit about lifestyle and a bit around more functional medicine, or thinking about questions that they could ask that is around what the patients are looking for. In medical aesthetics, also what they don't have in the NHS or really anywhere else in the healthcare market in the UK is time. It's the time for them to sit while they're doing a treatment on injections or lasers or anything else to say, look to the patient, what else is it that I could help you with to make you feel or look your best? That's such a great question to start a conversation with a patient, and it unlocks what the patient is looking for. It's then for the HCP, who is an entrepreneur, we must admit, they're also a healthcare practitioner, but they're also an entrepreneur running their clinic, to think about, okay, what can I offer this patient, potentially that they don't know about, that will give them what they need? And a lot of the time that is to do with maximizing their health. It might be vitamins, it might be nutrition advice. It might even be just thinking about, okay, you need to just improve your sleep to actually get the best skin quality. Because no matter what I do for you here, if you're only getting 3 hours sleep, you're not going to have the best result possible. So it's unlocking that kind of dynamic and that question conversation with the patients that the HCPs have time to do. Yeah. The good thing is that we've seen from market research is that not only do these patients have demand, interest, they also have the disposable income and they want to spend on these things as well. So we've got a captured market, we've got the HCPs that can deliver, and we have more and more treatments and products coming through this market as well that can give patients what they need.
Great. We've got a whole section at the end where we will talk about some of these opportunities for those that work in aesthetics, and so we'll do a further dive on that a little bit later on. I wanted to also bring up this just delve a little bit more in terms of how people are taking control and the role of tech within this context. So we were interested to know, given that it sort of feels like you can measure anything these days, really, and is what are the apps or what technology might people be using in order to achieve a healthier lifestyle? And we found 2 in 3 women that we surveyed were using health and lifestyle apps of some type, and the most popular being MyFitnessPal, which I was told I should know which one that was. I wasn't familiar with that one. I have tried Noom. You put me onto Noom once. I tried that one out. Yeah, I thought it was quite good.
How did you go with that?
Yeah, I quite like the sort of UX of it. I thought that was quite an interesting. Yeah. I'm a bit of a Luddite, really. When it comes,
you got thinking about food differently, not just about like a handful of sweets is not as good as a handful of grapes or an apple or something like that. Is that what it taught you?
Yeah, it was quite. I found the sort of UX of it really quite satisfying. It was quite nice. It was quite smooth, I found. I generally tend to find if there's too many barriers, I won't sort of engage with it. But
I think we were looking at different things in the Noom app. You came at it from the digital UX, user experience aspects. But yeah, in terms of the digital, there are a lot of options out there. There's almost millions of apps, I think, around health. The big challenge is that although people want to use it, they want some help, it's really the user experience we said first, but also like how long they stay on these and how much they can integrate them into their life, which is not done very well. That comes down to the user experience on one hand, but also at one point you get a bit of fatigue around the information that you're getting. There's only so much you can do as a layperson to actually try and integrate this information and understand it. And I think that's what's really exciting, is that almost 1 in 2 women think a doctor should be involved in improving their health. So we have an opportunity here to take some of this information that the consumers are already using and integrating, but looking at how we can interpret that from an HCP point of view. I'm not saying that they're like highly medical or they're extremely useful that way, but it gives some insight into, okay, well, how could this patient improve? And an HCP generally has a better understanding than a patient from that aspect, from their generic medical training. But there's also a lot of other digital aspects coming in. So there's things like measuring your glucose levels, so continuous glucose monitors that have been created for non-diabetics, which have apps associated, record your nutrition, record your exercise, record your glucose levels, and create an algorithm to score you related to your sleep and other environmental factors as well. That is also really interesting from a lifestyle point of view, and we'll see them become more mainstream as the tech improves. Currently, they're in a patch on the arm as a continuous glucose monitor, but it won't be long that they're incorporated on our watch as well. There's companies doing that. But there's other things that HCPs can combine from a medical point of view to add value to this digital aspect as well. So prescribers, medical aesthetic practitioners, there's things that they can measure, like, as I said, the glucose levels, but the BMI, the hemoglobin, the cortisol levels, other different hormone levels that really give a patient a better picture of their health and lifestyle and what they can improve. And there is really limited places where that can happen. And we really see that medical aesthetic practitioners are the ones that can really leverage that well.
It feels like there's potentially a real opportunity for them, the practitioners this is to help people understand the role of all of these different components, because it's, I mean, I'll jump on to the next slide, because we do talk about this a little bit in terms of, we ask people what sort of professional they want to see. We see it's a real range of skill sets that come out, and I suppose it's interesting to think with, and what's going through my mind is a conversation I had recently with a health app that we did some work with, and one of the things that they mentioned was it's very difficult to keep they'll call it, users, patients, consumers, whatever the topic might be. They find it quite difficult to get them to stay on their applications for a long time. They generally come in when they've got an issue and then drop off. And I wonder to what extent there's a whole, again, comes back to education, and it comes back to the role of the professional within all of this, that as we're able to measure these things, it becomes possible and our knowledge improves, whether actually practitioners need to really sharpen their skills when it comes to thinking about how they engage with patients in a way that they can help educate, not just diagnose and treat. And I was wondering whether you've seen any examples, have you got any thoughts on maybe whether that's a factor that needs a little bit of focus in the future?
Yeah, I think what HCPs can do firstly is stay open-minded to the opportunities that digital can offer, but also the opportunities that other groups in their community can offer. So in terms of this slide, it's how you can work with specialists in other areas to give patients what they need. And that's either through cross-referral or as an HCP entrepreneur, creating a program for a patient that can integrate some of these different areas as well. That's what we're seeing a lot of clinics doing. And there is products that are coming on that are kind of catalysts for this. As I've said, I work with Novo Nordisk. The weight management has been a catalyst for this for a lot of the clinics. And I think that's really where HCPs, if the question is just what can they do to integrate this and what can they do to help patients support this, it's being open-minded to what are the opportunities that I have with my background and what are the opportunities around me and my community.
Yeah. So I think for patients, if we think about the data, we've got patients want to improve, they want to take control of things. We know they're using technology, and we know that there's a role for healthcare professionals. But then what does it mean for the market, and what are the opportunities? And when we look at particularly within aesthetics, we know that women are 3 times more likely to go to aesthetics compared to to get treatment and to feel good and feel better compared to the national population. We know that they tell us it makes them feel better when they do engage with the sector, and they do want holistic interventions. And if you look at it by age, what we see is that for all of those up to the age of 50, around a third of women with a household income of over 50,000 say that, yes, they do want holistic intervention. They are interested in it. And we see as people get a little bit older, it's that, you know, it's less. And I wonder whether, again, it's to do with tech adoption, it's to do with exposure in the media, maybe being on social media and things like that. But I was thinking, Claire, you know, what's your kind of take on this in terms of the opportunities for the sector and the split by age groups?
Well, I think going back to your first point on the last slide is that patients really want to feel and look their best. So market research I did back at Allergan about 10 years ago now really showed that patients don't want to come in and look 5 years younger or 10 years younger or like themselves when they were 20 rather than what they are now, which is 45. They want to look and feel their best selves. So how they do that is really open for discussion amongst the age groups. So currently we're seeing that, okay, for the over 55-year-olds, it's really they're thinking about a jab here or a treatment there, and that's how I improve. The trend is for the younger groups to think, actually, I know what I put in my body is very important to affect the outside as well. So we're seeing that from the younger group, and we've discussed that with what we're seeing in media and what we're thinking, what we see the younger groups talking about, which is a lot earlier than what we started thinking about in our kind of 30s, 40s. So that's definitely a change that we're seeing in the market. All of these groups do go through medical aesthetics clinics, but it might be something that HCPs can think about when they're talking about their offerings and tailoring something to their different client database is, okay, who would be the most interested in this? We're looking at, okay, the little things that could be done for the 25 to 35, 40-year-olds. As you get a bit older, what are the kind of challenges that you think patients face at that age that are a little bit more holistic? And then the over 55s, what kind of educations can we give them to make them think, okay, you can get a better response to my toxin fillers or body sculpting treatment by doing X.
Yeah, and it's interesting when you think about the different components of, you know, a holistic approach to a topic like weight loss, for example, because if you cut it by age and look at what the dominant features and what people want, we see it's a real mix. So for those aged 18 to 25, they'll say that personal trainer is an ideal way for them to stay on top of their weight. If you go to 25 to 32-year-olds, they'll say apps, so the ability to kind of see information. Then for those that are 41 to 50, you see actually it's a real spread of different attributes they think that's important. But they see the role that a medical aesthetics practitioner could make. So it's sort of around that age group, you start to see a sort of dominance in terms of the input of that type of healthcare professional. And then for those that are over 55, they say, yeah, a dietitian will help. So you've got all these different understandings around, you know, what's important, and they've all got sort of different you know, I suppose desires for treatment and service. Obviously, that if you interact with a healthcare professional, they will give you advice and they'll be able to take you through your journey. But what would you say are the, and again, it's sort of coming back to this thing about service offering, but, you know, what are the kind of key considerations you would say for clinics, if you had a kind of blueprint of what they should be doing, given the variety and perception, what would you be recommending to a clinic at this point?
I think what it shows here, if you're thinking about weight, it is more than just diet and exercise, but for a lot of people, that's their first point of call. So how do you integrate that as part of a bigger program for the clinic? So how do you leverage potentially a PT down the street that you can cross-refer to, or you can create a program around? How do you do the same with a nutritionist? How can you integrate some kind of digital aspect as well? And how, as a practitioner, can you support economies of scale for your clinic and create some education that they can, that your customer database can access at different times? Maybe that's a webinar once a month on health and lifestyle with 10 minutes at the end talking about how they can make themselves feel and look better as well through other treatments that they offer. So I think really it's about looking at the different groups of patients that they have on their database, thinking about what kind of trends we're seeing in the market, using weight as a catalyst, because as I said, 67% of the UK is overweight or obese, and people do think about that as a major issue to start with, as a barrier to their health. And then how do you think about it more holistically, and integrate all of your traditional medical aesthetics treatments into that program as well. So it's really thinking for a clinic, what is my USP? What do my patients want? And how do I maximize a program to leverage those two things?
We wanted to look at, I mean, a topic that you know obviously quite a lot about was obviously around prescribed weight medication, and I think it's interesting to think about think about it in terms of holistic interventions for weight loss. But we found that there is a perception that it does play a role for people, and again, I mean, we've done work on this in the past together on different projects, but it's interesting that I've certainly noticed anyway, when you sort of interview different healthcare professionals, they've got a different level of sort of confidence, a different sort of language they might use when they talk about weight loss as a topic, and might use certain tools, for example. And how do you sort of find it when, particularly those that perhaps don't have prior experience in weight loss, or haven't necessarily focused on it too much, professionally, they haven't specialized in it as much as something else? Is there, what is it that sort of manufacturers are sort of considering and thinking about when sort of trying to help them sort of understand all the broader parameters of a service? Do you find that it's down to the education of the background, or is it there is also an operational component given the size of their practice and their USP and that sort of thing?
In terms of what manufacturers can offer, the market research shows very clearly that HCPs want from manufacturers networking, education, and materials to support. So Novo Nordisk is providing the education aspect, and there'll be more to come on that later in the year from BCAM and CCR. In terms of the networking, it's creating that best practice sharing aspect. But I think from the segmentation that we saw, with the work that we did, there was 5 different segments that we saw in medical aesthetic that related differently to weight management. What we found was that, again, that number, 67%, actually 2/3 of the market actually had some previous experience in weight management and felt confident and able to do it. The other 2 either just didn't think that weight management belonged in medical aesthetics, or they really thought it was diet and exercise and that was the only way to manage weight. So those 3 segments that we are working with at Novo Nordisk is really thinking about their weight management experts, and that may be they've come from a GP or another NHS background. I know some endocrinologists that actually work in medical aesthetics. There's a lot of different backgrounds that come into this very heterogeneous market. We then have the expert prescriber group, and those actually, we saw quite a high level of dermatologists in that group, didn't we? And they tend to be very comfortable with prescribing medication for things like skin originally, and it wasn't a big jump for them to go, well, actually medication can really affect the systemic body and the holistic body, and think about weight management in terms of the prescribing aspect for that as well. And then the third were very open to the idea, and they did see that by working with others that had experience in this area, so potentially creating a program together, as we've talked about with nutritionists, PTs or others, or utilizing someone within their own clinic, and that might be a nurse or someone who has an interest in nutrition. The HCP can do the prescribing, and then you can use others to support the program and the journey of the patient. And that really allows for a strong economy of scale, so you can see a lot more patients in a short amount of time than, say, what you do with Botox or fillers or another cool sculpting treatment. And you can leverage the skills that are already in the clinic.
Yeah, great. And you touched upon a topic here around, how clinics can offer a USP to embrace these type of services. And one of the things that, and I think it's an interesting one to think about is how the perception of aesthetics as a domain, and the data here would sort of reveal that maybe there's potentially a bit of a perception issue for medical aesthetics if it's going to be that leading the charge with holistic interventions. And I was thinking, what's your take on the stats that you see here? Do you see it as being a cause for concern, or actually do you see there as being a big opportunity?
Well, it's almost 13 years now that I've worked in this industry. So I've worked through the PIP issue, the Keogh review, and numerous different challenges that we've had in medical aesthetics and the unregulated side of this industry. And to be honest, I work predominantly with the top specialists. And from our discussions, it is really sad to think that this still is the case. But I coincidentally had a meeting with the JCCP, the Joint Council of Cosmetic Physicians, on Friday, and I put this to the Vice Chair and said, what do you think of these stats? And he wasn't surprised. And his feedback, and along with mine, was we work in such a heterogeneous market. There's a lot of different people doing a lot of different things that count as medical aesthetics. So the fact that 84% of women think that it's more described as beauty than healthcare is more than likely because they see a tanning salon doing fillers or Botox. Now, we know that that should not be happening. It should be very much more in the health aspect because of the risks associated with those treatments. So there's a lot that we can do in the market, and I've talked about this for 12 years now, unfortunately, to regulate this market a lot better, to make it clear to patients that what you're doing, if injecting something in your face, is not just like getting your eyebrows done or your nails done. It is a treatment that requires supervision by a prescriber, a healthcare practitioner, so that they can deal if anything goes wrong. But an opportunity that I see from this is that those healthcare practitioners, the medics or nurse prescribers, all of those groups that are highly qualified, educated, trained individuals that have a huge amount of skills, can almost use this as a way to differentiate themselves against those that are really on the beauty aspect. Because things like weight management, things like nutrition, things like hormone evaluation, or even hay fever treatments really should be classified as medical. So a lot of those things are regulated by the CQC, depending for weight management what BMI a patient is. But that is a way that they can regulate and differentiate themselves and really set a stake in the sand, I guess, to show consumers that no, what I do is not beauty. What I do is make you look and feel your best through a healthcare aspect. It's a medical treatment that you need a qualified healthcare practitioner to do.
And I was kind of curious about, obviously, given that lots of healthcare professionals who get into aesthetics will come from medical background, what's the sort of uptake when it comes to, talk about things like marketing or talk about how you actually position yourself in the market? Is that something that requires quite a bit of work, or do you think they're quite natural when it comes to thinking these things?
Well, I think there's always been that challenge, as I said, remembering like at my Allergan days where we did a lot of training on consultation techniques. And again, I think that's the manufacturer as well's responsibility within the ABPI guidelines to help HCPs in the private market to understand how they can promote their treatments that a patient is needing. So there's making sure that you get some ideas of questions that you can ask a patient during a consultation, but then you can also get help through manufacturers on the marketing aspect, and also really understanding who you can refer back to as well in terms of education. Either that's you creating something yourself, or there are a lot of education opportunities out there. I know in thinking about the things that disease awareness that different manufacturers offer, for example. I think it's been a big change over the last 10, 12 years, is that the business aspect has become less of a dirty word for clinics, and really, no, you have to do that. So getting abreast of your marketing, the legalities of it as well. There's so many different assets available, say through the Aesthetics Journal or different congresses about the business channel, and there's lots of different consultants out there as well that can help you with the clinic marketing. First of all, the HCP needs to get abreast of the right product for the right patient at the right time, and then how do you think about that, accessing that patient to make sure they know about that treatment?
Great. So I'm conscious of time, because I know we've had some questions come through. I think there's obviously it's a massive topic. There's loads we can talk about, and we'll try and cover a few things off in the Q&A. But in terms of some of the observations we've seen from the data we know, from the research we've done, there is a desire for people to take control, and we know there is a big role for healthcare professionals to play. So despite the fact there's all these hundreds and thousands of applications that might exist that we're all using on our devices, we know that actually there is a huge role for healthcare professionals to play, and those that are actually involved in broader facets of, you know, a healthy lifestyle. Medical aesthetics does have some perception barriers to overcome, but as Claire said there, there's plenty of things that clinics can be thinking about. There's lots of changes and regulations that are coming that will naturally just help to overcome these things. And Claire, what would you say your main considerations for those working in the market might be from the work we've done together?
Yeah, so it's making sure that you understand that patients want to look and feel their best. They don't just want to have one wrinkle treated. That was treatments that we did 15, 20 years ago, because treating one wrinkle will not improve the whole face. It works exactly the same for the body. Treating one little aspect of subcutaneous fat with CoolSculpting will not make a difference to how the patient feels and their confidence longer term. So it's making sure that patients want to look and feel their best, not just now, but also longer term. Then creating the loyal patient group. So there's a lot that you can do in terms of maximizing and leveraging your patient group with things that we've established that they actually do desire. And then differentiating from beauticians. Like, as I said, it's devastating that we're still talking about this 12, 13 years later and after PIP and KEO and so forth. Things are slowly changing, but there's a lot that clinics can do themselves to make sure that they are offering treatments that beauticians can't offer, or that they know that they can do in a much better way than beauticians. And making sure they provide that added value as well, something that might not be extremely expensive for a clinic to offer, but has a really high value for the patient. So it's making sure a clinic looks at what they can do, what their USPs are, what they can offer for the patient that differentiates themselves.
Right. Brilliant. I'm just going to move on to any questions that we might have for Claire, in brackets, and myself.
Yeah, we do have a few questions come through, and I know a few people joined a bit later on, so for those who did join a bit later, if you do have any questions, then please do send them through in the Q&A button on the bottom of your toolbar. So the first question, it's a bit of a two-parter. So we have, should qualified HCPs specialize in other areas outside of their profession to offer increased quality of care? For example, midwives in medical aesthetics getting extra training in nutrition or weight management? And if so, what can manufacturers be doing to support this?
So I'll take that one first. Yeah, I think there's absolutely no reason why healthcare practitioners or other relevant decision makers can work in different parts of medical aesthetics. We know that a lot of people move into this area for a better work-life balance, but still wanting to make sure that they're giving people, a society, benefits. And you can do that through medical aesthetics by improving their confidence, improving how a patient feels. So absolutely, I would say anyone who's qualified can come into this industry, as long as they then get the right training at a very good level. And as we said, there's regulation coming in to support that even more, to make sure that they're giving the patient the best journey and response. And I think in terms of the second part, in terms of what manufacturers can do, really, as I said, the market research has shown that manufacturers should be offering training, networking, and materials to healthcare practitioners. So there's that as a basic level. If you're providing a product, you should be providing that to go with your product. So that's things like what I've previously done at Allergan is the Allergan Academy, for example. That's really highly regarded. Teoxane does something similar as well. Novo Nordisk is creating medical education modules, and then potentially working with your local business development manager of who can I speak to in my area or a bit further away to really understand how I could do this better. Manufacturers are very much open to supporting that, because they know that when you improve your business as a clinic, they improve their business as a manufacturer.
You find, I mean, it's just we see a lot in research that lots of the reasons why people won't take on new treatment is like an operational thing. So I think it's roughly 40%, if not half, of the market are single owner operators. I mean, what's the sort of, do you see there being quite a bit of a barrier in terms of how they manage a business to be able to offer new treatments and services?
Yeah, and I think that's probably where the area of business consulting in this market has come about. It's really when you're a single operator, how do you make sure your business is continuing to grow and thrive, if that's what you want to do, or you just want to stay in the same area? That's another thing completely. But I think, like any new treatments or trends, the major challenge is going to be competition. So if you're not offering something that your patients want, then someone else down the road will in this industry. So it's therefore really important for clinics to understand how they can differentiate themselves against that competition. And for example, weight management might be one option, nutrition generally, or hormones or vitamins, something like that could be other opportunities, along with high quality skincare, for example. But making sure that you as a clinic or you as an individual prescriber actually offers a whole program for a patient, which incorporates both the traditional medical aesthetic treatments and other value-added support, is a great way for that clinic to differentiate themselves. And again, I go back to that USP. What do you stand for? What would attract your patients to you? And that's what you need to think about, really, at least once a week, if not daily, about what am I doing to make myself stand out as a clinic.
Yeah.
Perfect, great. So we have another question. Where do you see the medical aesthetics market going in the next 5 years? Do you expect more treatments for other healthcare issues outside of weight and nutrition being introduced?
Yeah, I see a lot of the anti-aging aspect, or pro-aging, some people like to call it, the science of aging. We hear from Allergan, for example. So it's not going to be only, okay, I want to improve my aging face now or my aging body now. It's, as we said, what kind of person do you want to be at 70? There's a lot of discussion in the fact that potentially within our generation or the next generation, someone is going to live to 150. Whether you like that or not, whether you want to do that or not, someone will. So it's how do you want to feel over that 150 years? That's going to be a really big part of our society. Medical aesthetics have a huge opportunity, and a lot of manufacturers are seeing the medical aesthetic side, given that they're both entrepreneurs and healthcare professionals, as a channel for this. So we know companies like Nushido, like Glycanage, and as I said, even Allergan with their science of aging have this as a focus. Novo Nordisk, who I work with weight management, and that's a catalyst for thinking about other things in terms of chronic diseases. Their history is diabetes, for example. And it's not only manufacturers that are pushing this, because places like the Aesthetics Journal are talking about it more and more. And I don't think I'm giving anything away here by saying that CCR, there's going to be a focus on it as well. I believe there's even going to be a stand on medical wellness. So that's such a huge sea change, and we're only going to get bigger and bigger over the next few years with that. As I said, COVID's been a big driver for that, but it's not something that's going away. Like COVID, medical wellness is not going away.
No. I have to say, I do find that the question, what kind of 70-year-old you want to be, quite an inspiring one. Actually, it's sort of, when we talked about things over the last couple of weeks, it's an amazing question, because so many people operate in a very short-term manner. It is a really great question to ask people. I think it's quite a leveling one as well.
It is, yeah. And there's so many things that we can do now to support what that looks like. And as we said, the younger generation has realized that a lot earlier than a slightly older group. And I think also combined with the fact that we're realizing we can't rely on the NHS for making us better immediately. If we do have issues at 70, we will still have to wait a long time. So preventing how long or how soon you have to deal with the NHS is another thing, another way to think about it. So a lot of people are thinking about this, and the trend is growing as the generations come along.
Great. We've got one more which kind of touches upon the perception topic that you spoke about earlier. It says, could holistic offerings drive a change in perception for medical aesthetics in the distant or near future?
Well, I really hope so. I think from another market research survey we did, something like 73% of patients wanted their medical aesthetic practitioner to be CQC registered. I think that you presented that in the last webinar, which was quite a surprise to me, the fact that consumers are starting to understand what CQC is. JCCP and me have launched, so that's a website directly to consumers to understand what they should be looking for. And there is so much coverage nowadays in the media about things that could go wrong, and they do go wrong, and how the best way to treat that. So the best way to treat that is by avoiding it altogether. And that's going to someone who is reputable, has a high level of training, and the regulations are going to be improving. We'll see that very soon. And I just hope that it really does make a change, and it makes that change in perception to the consumer in a more wider view.
Great. Well, I think that's probably the perfect place to wrap up. Thank you very much, Ben and Claire, and for everyone joining. The webinar was recorded, so I will send around the recording for you to watch back later. Have a wonderful day, everyone. Thank you.
Right. Thanks, Claire.
Thanks, everyone. Thanks. Bye.
Bye.
Bye.